Hi ma'am, good morning. My
Good
name is
morning.
Gabriel Luneta Cagas and I am your student nurse for today. May I know your name ma'am?
Sheena Manales.
Okay. So for today, I'll be teaching you prenatal exercises. Do you have any idea about that ma'am?
Exercises.
Yeah, it's exercises. But these kind of exercises are not those strenuous or vigorous activities because this is intended for pregnant women like you. This is somewhat like a mild exercise and it can reduce backaches, constipations, and also it can boost your mood and energy levels. Okay, ma'am? Okay,
Okay.
so during the exercise, you don't need to be worried because you'll be safe because I will be teaching you how to do it properly. And also, when you're at home, you can ask help from your partner to do it properly. Is that okay, ma'am?
Yes.
Okay. So as I can see, you are already wearing your proper clothing and proper footwear. This can help you move properly during the exercise. So before we proceed to the exercises, I need to conduct the proper exercise guidelines for you to follow and to prevent unnecessary incidents. Prior to exercises, first, avoid vigorous exercise in hot, humid weather if you have fever. This is to avoid overexerting yourself or developing hypothermia. Avoid that, mama. Next is avoid activities that require jumping, jarring motions, or rapid changes in direction such as jogging, because joints in your body may be unstable late in pregnancy. Exercise on a wooden floor to a tightly carpeted surface. This is to reduce shock to the abdomen or knees and to provide a sure footing. Next is avoid exercises and motions that involve deep flexion or joint extension, such as stretching with the toes extended. This is to avoid muscle cramping, and I'm sure that you don't want that your muscles will be in cramp because it's very painful. Always start your exercise program by warming up for approximately 5 minutes with activities such as slow walking. So before exercising, warm up for 5 minutes. Yeah. This is to allow time for the body to adjust. Next is drink liquids liberally before exercise. So before doing such an activity, drink a lot of water to prevent dehydration. Eat protein and complex carbohydrate snack before exercise. Make sure that the caloric intake is adequate. This is to help maintain serum glucose level and to meet not only the extra needs of pregnancy but also those of the exercise performed. So now during the exercise, ma'am, do not exercise in the supine hypotension after the 4th month of pregnancy. This is to prevent supine hypotension syndrome. It can cause dizziness to the pregnant. When getting up from lying on the floor, do so gradually. So kung naghigda ka gikan, ma'am, hinahinay kag bangon. This is to prevent dramatic blood pressure changes or stretching of the round ligament, which can lead to sharp abdominal pain. So again, ma'am, hinahinay kag bangon when you lie. Kung gikan kag nakahigda sa salog. Measure your heart rate at times of peak activity. Talk with your obstetric provider about target heart rate and limits. For you to measure your heart rate, subtract your age from 220, then multiply by 70 to 85% to target heart range. This is to avoid exercising beyond the target heart rate. And if necessary, interrupt your activity to replenish fluids. So again, in between your exercises, drink again a lot of water to prevent dehydration. Next is stop any activities and contact your obstetric provider if any unusual symptoms appear such as dizziness or vaginal bleeding. This is to avert any danger signal. Perform an activity stimulus phase of 20 minutes. Strenuous activities should not be performed for more than 20 minutes. So at 20 minutes lang, ma'am. This is to prevent over-fatigue. Avoid exercises that employ a Valsalva maneuver, the holding breath while bearing down. So that you need to avoid that, ma'am. This action increases blood pressure and decreases blood supply to the fetus. So now, ma'am, after the exercise, end your exercise program with a period of gradually declining activity that includes gentle, stationary stretching. Do not stretch to the point of maximum resistance. So, ma'am, when you end your exercise, do minimal activities na lang, such as stretching, but not to the point na it can cause pain to you. This is to prevent increased risk of joint injury. And again, second to the last, drink liquids liberally after exercise. Again, this is to prevent dehydration. So after exercise, drink a lot of water, mama. And lastly, perform scheduled exercise periods. You can exercise for about 3 times a week for 20 minutes. And this is for regularity and consistency of the exercise program to achieve optimum health. So, ma'am, that's all for the proper exercise guidelines, and I hope that you will be able to follow or perform the guidelines for you to be able to do it properly and prevent incidents or injury such as abdominal pain, joint pain, and muscle pain. And also, I hope that you will be consistent in it to achieve optimum health. Okay?
Yeah, sure.
Assume sitting position with knees toward the floor until there's a feeling that perineum stretches. Do not put one ankle on top of the other, but should place one leg in front of the other. Move to the squatting position, knees over your toes. Keep your heels on the floor. Feel the stretch in the back of your thighs. Hold for 20 to 30 seconds. Gradually increase the time to 60 to 90 seconds. Relax your head and arms throughout this exercise. Squeeze the pubococcygeal muscle surrounding the vagina as if stopping the flow of urine. Hold for 3 seconds. Relax. Repeat the sequence 10 times, 3 times a day. Flutter exercises. Squeeze and release. Then squeeze and release as quickly as you can 10 to 25 times. Work up to doing 100 Kegel exercises each day. Practice blowing a candle by taking a deep inspiration, then exhale normally.
Hold finger about 6 inches in front, as if it were a candle. The client then exhale forcibly, pushing out residual air from the lungs. The client can feel the abdominal muscle contract as she reaches the end of forcible expiration. A client should assume a kneeling position with both hands on the floor. The client first hollows her back, then arcs it.